I am Julie Turner. I'm a nurse practitioner and I'm a high-risk breast cancer specialist. I grew up in Louisiana and I went to nursing school originally in Monroe, Louisiana at University of Louisiana, Monroe. I actually started out in dental hygiene and my teacher was always getting on to me for being behind on things, and I wanted to talk to the patient more and I wanted to manage the patient from a holistic standpoint. And so I realized very quickly on I was looking into nursing the full body approach. I didn't want to just stick with the mouth. And so I love taking care of patients. I love taking care of patients physically, emotionally, mentally, everything. And so that's actually why I went back to school to get my doctorate as well, so I could be the sole provider for my patients. Found out a couple years ago when I was at a health fair that I had a genetic mutation. So I have a BRCA1 mutation. And so after I found out, I thought, okay, what's next? What do I do next? And how do I manage this for myself? And so after that happened, I realized that there's not one person that really specializes in that area that can follow you. You have OBGYNs, you have family practice, you have GI doctors, all of those people that specialize in their specific line of work. But for people that have a genetic mutation, besides a geneticist, there's not a clinic that can wholly manage the patient. And so moving back here after I got married, I realized what can I do for this underserved population, especially this underserved female population that have a high risk for breast cancer. And so that's really my passion, because I relate to them. You know, I have a high risk for breast cancer, and so I want one person to manage their care instead of them feeling like you have to piecemeal. I'm the quarterback for their care, and that's why I'm passionate about it. I want to make sure that I manage each aspect of their cancer care. We start out with what your actual risks are and develop a specific care plan for your life. So what do you need annually? What do you need biannually? Things like that. How can we follow you? And as guidelines change, I stay on top of it. So your care plan may change throughout your lifetime, but what do we need right this moment? What do we know is evidence-based practice for patients that are high risk? So we come up with a specific care plan for your needs. You can consider me Dr. Turner, but I love being a nurse practitioner because I feel like it's a role that I've been put in to make sure the patient feels like they can get to know me on a personal level. And I think that I like for patients to know that I'm not just here just to help you with your breast risk management. I'm here to help you as a female, as a whole. What can we do? Do you need a primary care doctor? What's going on with you? I want to make sure patients know that I'm here for them as a whole. This isn't just one aspect of your care. How can we get you where you need to go? And I want patients to feel empowered by this visit. I want patients to feel like they don't have to be anxious about their risk. I want them to feel on top of it and that they can be proactive about their care. And so that's the point of this clinic, is to make sure that patients know that we're going to be on this side of it instead of worried about it all the time. I want it to decrease anxiety in their lives. I want it to be something that they enjoy. I've been married to my husband, Shelby Turner, for 3 years. He's also a nurse. He is a nurse anesthetist now too. We both went back to school to further our career. We have a 7-month-old daughter, Sadie, and she's the joy of our lives. And then on the weekends, I actually love to run. I'm a long distance runner, so I'm trying to complete a half marathon in all 50 states. So I think I have 14 states now, so I'm working on it. I enjoy playing my guitar. We are very involved in our church, so we have a small group that we're involved with. We go to Fellowship Bible Church, and so if we're not on the ground playing with her, we're with friends at church. So.